In the heart of Honolulu, Hawaii, new advances in reconstructive surgery are changing lives. Dr. Daniel Murariu is a plastic and reconstructive surgeon at Athena Clinic and clinical associate professor at University of Hawaii John A. Burns School of Medicine. He partners with local hospitals to use the Da Vinci surgical robot, which offers less invasive procedures and helps patients recover faster.
I became a doctor because of my passion to help others. I find the use of technology to be very influential. Not only helps the patient, but it also maintains my job as a surgeon to be able to use the technology that was once only thought of in the sci-fi movies. It's actually very rewarding. There's a lot of collaboration between plastic surgeons and other specialties. We're often called the surgeon's surgeon.
Hello, I'm Michael Krishna Rao. I'm a colorectal surgeon here at the Kuakini Medical Center, and I've been doing this for 3 years as a solo practitioner. Having a good team is crucial to being able to take care of these complex patients. I'm very lucky that here in Hawaii we have Dr. Murariu present. He's able to help me do these procedures in the best way possible. So today we're performing an abdominoperineal resection, or basically a resection of the rectum and the anus. This cancer causes significant problems for people with both body image, sexual health. It completely will change your life.
From the patient's perspective, he will undergo a big surgery today. But it's going to be a long day. I don't want you stressing out. Everything will be okay, okay? We'll take good care of him, I promise. All these marks, we're just marking. For the time being, I'm just going to mark all three. We're going to listen to the main one. And it sounds great. Once we're going to be intra-abdominal, the gas is going to expand the superficial layer. So we're going to be able to elevate the muscle from the inside safely. The surgery is going to be a little bit more extensive, where the patient is having a large part of their colon removed. They're going to have an endostomy that's going to be brought out. Traditionally, we do the reconstruction via an open, large incision to take the skin, fat, muscle called VRAM flap. This time it's being done with the robot, and I'm the first surgeon to use the robot to do this type of surgery. The robot allows us to make very small incisions to be able to gain access to the intra-abdominal contents. Once we're inside the abdomen, what we do is we raise the posterior rectus sheath. It's a layer underneath the muscle. Then we're able to dissect the muscle off the abdominal wall. And then we're able to place the muscle with the overlying skin into the pelvis. The opening where the anus used to be needs to be closed up using fresh skin that's not radiated to combat the effects of radiation.
The Da Vinci system allows them to operate through tiny incisions. By working from inside the body, they reduce scarring and shorten hospital stays. Patients often return to normal activities sooner with fewer complications.
Traditionally, this surgery was performed with a large incision into the abdomen. In modern times, we've been able to use the robot to do these surgeries through very small incisions or small cut surgery. We're able to do a more precise dissection in the pelvic area, which helps prevent post-operative complications.
It has 3D magnification, so you're able to see everything very clear. It allows us to do movements with the instruments that would actually be very hard to do. It takes away the tremor that we can normally transmit during open surgery, so that improves the way we're able to do surgery because we're going to be a little bit more precise.
From transforming rectal cancer care with cutting-edge robotics, we now turn to a different challenge: breast reconstruction after cancer.
My name is Peter Deptula, and I'm a plastic and reconstructive surgeon based here in Honolulu, Hawaii. Today, we're going to be focusing on reconstruction after breast cancer, and we will be performing a breast reconstruction with the DIEP inferior epigastric perforator flaps, the gold standard for reconstructing the breast from patients' own tissues.
This is a second type of case that I use the robot to harvest a flap. It's basically harvesting tissue, skin, fat with the artery and vein below the belly button and reconnecting it to the chest wall vessels.
Today's patient has a history of breast cancer and underwent prior mastectomies. At the time of her mastectomies, we placed a tissue expander to help manage the skin. And today we're going for a second stage reconstruction where we exchange the tissue expanders for tissues from the abdomen. So we're reconstructing her breasts, not with implants, but with her own tissues. Well, these surgeries are a little bit more complicated, and it does require a team approach. 2 attending surgeons to harvest the chest vessels in preparation to accept the tissues from the abdomen, while the other surgeon is at the abdomen raising up the abdominal flaps and preserving the tiny blood vessels that will reconnect later in the surgery.
In order to get the artery and vein, we have to go through the fascia, the muscle, and potentially some nerves to reach the pedicle of the artery and vein. If we use the robot, we'll be going through the abdomen and we just dissect one layer and we find the artery and vein. Therefore, we have a much smaller fascial incision and we see less risk of hernia. We see less chances of bulging.
For Tanya, life changed after a double mastectomy left her with implant problems.
In March of 2020, I was given a breast cancer diagnosis. The only option given to me at that time for reconstruction was breast implants. They said any of the other autologous flaps and things were not an option, just that it would be too invasive, it was too risky. That was really the only option I had. During that time, I moved to Hawaii, and there was no one in Hawaii that did any kind of reconstruction for years. Thankfully, Dr. Murariu and Dr. Deptula finally moved to Hawaii, and so I was finally able to get the surgery done this past summer. And I can't tell you enough how much my quality of life has changed getting my breast implants out.
Being able to offer it to patients is important because we've been doing this procedure for 30 years now. But over time, we have seen that, well, maybe it's not so benign as we think it is. Many surgeons have been looking, how do we minimize the impact on the donor site? There are different techniques to do that, but none of them are quite as impactful as the robot.
Dr. Murariu is one of half a dozen plastic surgeons in the U.S. performing the DIEP flap reconstruction for breast using the robot. He has put Hawaii on the map for breast cancer reconstruction, with patients traveling from as far as Florida to have their work done here. Surgeons from around the world have also traveled to learn the robotic technique firsthand.
We have always been at the forefront of innovation, and we pride ourselves in being able to adopt technology early on, whereas with the robot, we have not until the last few years. With the widespread integration of robotic technology, we continue to push the edge of optimizing patient care.
Here in Honolulu, Hawaii, modern medicine continues to redefine what is possible for people everywhere, proving that the truest measure of progress lies in our capacity to elevate the lives we touch.